Hello, this is Gayle Palmer, the osteopath from the Living Elements Clinic, and today's topic is light sensitive disorders, or disorders which cause photophobia, where you are unable to tolerate lots of light coming into your eyes, and they can give you other symptoms. So migraines, disturbances with your balance, so those are vestibular disorders. So I thought I would talk about those a bit more detail, because a lot of people do not realise that osteopaths, and especially cranial osteopaths, are able to make a difference to some of these. So the most common disorder which is light sensitive and gives you vestibular disturbances are vestibular migraines, and those are migraines which give you a sense of disorientation, dizziness, vertigo, can lead to vomiting as well. And one of the trigger factors is often light. And light in the form of very bright light. It's September here now. It's a beautiful sunny day and I'm squinting, as you can see. But also fluorescent light, so things, fluorescent lights in offices in particular where they're popular, or flickering lights from TV or computers or iPads, phones, etc. Those often are a trigger factor. And those can make a huge difference to whether you're going to get a migraine or not. Just that extra light is enough to trigger the whole cascade of symptoms that you then get. Other causes of light sensitivity, traumatic brain events and post-concussion events. Those are often reasons for problems with light sensitivity and photophobias. Again, all the same things, different types of light and flickering lights, particularly in the autumn. You know, I have this occasionally, although less so now. You go through a low sun and lines of trees in the winter, and you get that flickering effect, and you can probably see that just by me shaking my hand there. That can trigger your nervous system to cause an event. Sadly, 40% of people who have traumatic brain injuries will end up with ongoing long-term symptoms. So it's something that, if possible, that can get addressed quickly and early after an event like that, can make a real difference for the rest of their lives. Other things, Menieres disease, surprisingly common. 40% of Menieres disease patients also get migraines, so a really high percentage. And Menieres disease is characterized by dizziness and vertigo in particular. Sometimes it's accompanied by a slightly stiff neck, but is not related to meningitis, which is an infection in part of the brain membranes. It's actually due to a build-up of fluid in the semicircular canals which organise your balance system. There are three, so that you have all planes activated when you're moving, and that helps give you a sense of where you are in space. As I said, 40% of patients with Menieres also have migraine problems, but with Menieres, often their eye movements also make a difference to how dizzy they feel, and that is aggravated by light and increased light sensitivity too. Light sensitivity can give you complex or distorted images, and although that isn't directly related to the light sensitivity, the processing in the brain is, and the parts of the brain that are. So if there are disturbances with that, that can affect how other things are working. So that's something to really bear in mind. For some people, looking into a shop window, that will trigger something. Watching cars passing by. There's no age distinction or difference, or factors related to vestibular condition, the health of that makes a difference to whether you're going to get it or not. So it's not age dependent. So how do you go about treating it? First of all, proper diagnosis, really important, and osteopaths are especially good at that, partly because we are not only able to listen to what our patients are saying with enough time to do so, but we have extremely sensitive hands and they give us extremely important and accurate information about what's happening and where. One of the most common desires when you have a vestibular event going on, with or without photosensitivity, is to go into a darkened room, lie down, cut out all sound, stay still, and that's fine. But one of the things that they have found, if you do that a lot, actually, instead of improving the situation, it can aggravate the situation. Back in the early 1990s, there was a whole load of research as well about us using a special kind of lens for your glasses, and it was a special tint known as an FL41, and it has been shown, because it slightly reduces the light coming into your eyes, that it cuts out migraine attacks by about 74%, which is awesome. But over time, it works by cutting out the blue-green wavelengths, and that tends to desensitize the brain for dealing with that. So that's something that might be worth looking at. And other things include vestibular rehabilitation. There's a whole series of exercises that you can do if you have Menieres or vertigo generally, with specific exercises to help make your semicircular canals work better. As an osteopath, I'm able to give you those exercises as well, but cranial osteopathy works brilliantly for so many of these conditions, even if they might not cure it initially. Just by reducing the frequency or duration of the symptoms can totally transform someone's life. So if you're interested in finding out more, or you want to have a consultation, by all means use the book now links and make an appointment to come and see me. I hope that's been of interest to you, and might even have surprised you. So if it has, put a comment below, and thanks for listening. Take care for now. Bye bye.